That's a husband and wife team. So welcome to the 6th Annual Pullman Regional Hospital Innovation Summit. I'm glad you're here. I appreciate seeing you. You being here is a manifestation of your involvement and your care for the community and for the hospital. And we're grateful to you. Thank you. Within the Innovation Center, the Center for Learning and Innovation, we have a steering committee, and I'd just like to take just a moment to recognize the people, or to name the people that are part of that steering committee. There's Scott Adams and Jeannie Eiler, Steve Phoebus, Megan Guido, Marie Mays, Noel Nicolai, and the director, Becky Heifel. Becky has been just remarkable in the last few weeks, even more so. Becky's one of those get-her-done kind of people. No job's too big, no job's too small. She's been sick, she's had a URI. She's sitting right down here with her husband, Michael. So, yeah. So, Michael, would you give her a healing hug? Oh, cool. And then, part of the prescription is for you to repeat that BID for 3 days. And then if it doesn't work, just call my answering service. Okay? So, what do you think about that video that we just saw? I got to tell you, I hate it. So, when Becky suggested that we look at it, I had some discomfort with that. I love being a doctor. I love being in healthcare. And that video gives me indigestion. As we were talking about it, and Scott was sitting beside me, and I said, I don't like this. I hate this video. I don't want to show it to people. And I said, I don't want to show it to people at the Innovation Summit. And Scott looks over at me, and he kind of does that grin, and he says, you think they don't know? You know, don't you? You know what it's like. And part of what we've done tonight is to go through these scenarios in preparation for asking you to help us to design a different form of healthcare for our community. You have 3 questions at each one of the tables. They're on a little triangular piece of paper there. Becky, would you, so on these right here, I'm going to ask you to take 10 minutes at each table to think about those questions, to talk about them, to come up with some answers, and kind of have one person at each table that's going to be your reporter, perhaps, or will kind of gather what some of that information is. And then we're going to have a community discussion in 10 minutes. Thanks.
You advance the slide.
All right. You look and you sound engaged. So next, I get to introduce Shelley O'Quinn. She's getting an orthopedic consult about how to come up here. So, Ms. O'Quinn was the senior program officer at Innovia Foundation from 2007 to 2008, and they liked her a lot. And in 2017, they invited her back to be their CEO. She's been the Director of Education and Workforce Development for Greater Spokane Incorporated, and she served as a Spokane County Commissioner. She has a BA in Accounting and Business Administration from Whitworth University in Spokane. She has an MBA from the Middlebury Institute of International Studies in Monterey, California. Yeah. She's going to facilitate our group discussion around the 3 questions, with the goal leading to some shared understanding of what an ideal healthcare system would look like for us.
Thank you. It's great to be here tonight. Thank you. This is how I keep myself on track, since I know we're going to have a great conversation. I was asked earlier tonight if these are props and part of the evening. I would love to say that they were, but they're not. I need them, so thank you for indulging me and allowing me to sit up here as we have this conversation. I know that being from a community foundation and not having a professional background in medical field, many of you may be wondering, why am I sitting up here to help facilitate this conversation? And I will tell you that I have lots of experience as a patient, for one, but I'll also say that this conversation is that. Sorry if this fall. It's a community conversation that we want all of you to be a part of tonight, to think of yourself as a patient. As we have the conversation to talk about what we don't like so much about our current healthcare system, what we love about our current healthcare system, and then finally, if we could wave our magic wand and we could reinvent and rethink healthcare in any way that we could, what would that look like? And the conversations, we asked you to have those conversations at your table today. First, so that you can understand that we are actually going to use this information, Scott and his team, as they move forward. So this isn't just about having a conversation and then, okay, thanks, let's move on. We are actually going to use the information that we gather from the community as we move forward in this next era of excellence, which Scott will be sharing more with you tonight about where they're going and where we've been, where we're going, and what that looks like for this community. But we want to make sure that in this process, your voice is heard. Your voice, the community voice, and so we decided to make that a part of tonight's event. So we're going to have a conversation, and I'm going to ask you for folks to share out what you've discussed at your table around each of these. And we do have people that are around the room that are capturing this information. So speak loud so that we can make sure that that's all put together. And I'm not seeing where Becky is. Do we have microphones that would be, oh, good, we do. So we have, great. Do we have 2 here? Is that what we have? Okay, so let's start with the first conversation. The first question, what is your biggest challenge with our healthcare system? Who wants to be the first brave person to share out what their table has discussed? I see in the very back someone waving her hand wildly. If we can get a microphone.
Thank you. Well, hello. My table, we immediately started talking about bills and how 'cause sometimes it's kind of frustrating. We're not sure what we're being billed for. Maybe it's an account number, but it doesn't really always have a reason. And we feel like we have to figure it out. It's not intuitive or obvious. That's it.
Great, thank you. Others? If you'll raise your hand, someone will bring a mic, and then we will get to you. I'm not sure who has a mic, so stand up when you have one.
To follow on that comment, our table talked about not just the not understanding, but scared to go for health care because of the cost and the lack of insurance and several other things. But
So not just the not understanding the bills, but actually being, not even knowing what the cost would be.
or afraid of
And-
cost.
Yeah, very true. Thank you very much. Next.
So we're a different table. We're all healthcare providers. And so maybe our perspective is a little bit different. And I'm using my words, not any of yours. So accessibility. That means accessibility with respect to insurance, with respect to everyone getting health care, it being a right instead of a privilege. Accessibility with respect to what type of providers are in our community, not taking 6 months to get into a specialist, and having all specialties available and not having insurance dictating the provider's care. So accessibility.
Thank you.
Okay, so I will add to what she said as a parent of young kids. You know, illness strikes at all times, so we talked about getting in same day. We know that several of our awesome providers here try to have same day appointments a lot, but you call at 9:02 and it's like, no, I'm sorry, but we have an opening in 2 weeks. Anyway, so we discussed that here.
Great, thank you.
I'm standing up because otherwise nobody would know whether I was standing or not. So we had a variety of the same comments at our table, one of which was multiple billings by the same providers. And as we get different bills, it becomes a challenge as to who gets paid what and covered by our different insurances. Care providers prescribing items or care that is not necessarily covered by insurance. And then that becomes somewhat of a challenge. And then last but not least, and I'm playing right into Scott's hands, parking.
Thank you.
Hello. So our group talked, first of all, about poor coordination in terms of communication and information sharing, which I think was really represented well in the video. And then we talked a lot about a lack of transparency around costs and how healthcare decisions are made, and feeling that in terms of the care that actually gets provided and the care that patients have access to, that it's still largely driven by our fee-for-service model rather than where the value actually is for the patient.
Thank you. And I think we're over here. And then we'll do one back here, and then I want us to jump into question number 2.
Sure. So our table was, I would say, very savvy, and immediately went to why can't systems talk to each other, and why do I have to keep filling out the same form and say the same thing? Can't you guys put this in a central repository and pull all of that up? So very much around the coordination. And then the billing was also an issue that why can't it be more descriptive so that I can understand what my bill is?
Thank you very much.
One other comment that our table made was the lack of ability to have preventative or wellness, health promotion kind of activities paid for.
Great, thank you. Is there anyone who has any last desire to throw out a final comment on this table 9? They'll get the last word in on question number 1.
All right. We have a very involved table.
Oh, she has notes.
And we observed keeping track of appointments is a big challenge. The breach of coordination between insurance and the practitioners and the patient. And efficient use of time for everyone, just the best use of resources. There seems to be a lot of waste.
Great, thank you. And on that note, make sure you keep those notes because we would like to collect those. Thank you. All right, I hope that you are, as you provide some really good answers for number 1, and I hope that you'll be able to provide that same one for number 2, because we do actually have some fabulous things happening in our healthcare right now. So what are some of the positives in our current system? What are the things that you love about the way our current medical system works? And I know that there are positives out there. We'll start with table number 2.
So if you're sick or you're injured, we're really good at taking care of you in that kind of crisis time.
Thank you. Next. Great.
So things have come a long way, and we're using evidence-based medicine on a regular basis to be able to provide care, and people have a high level of confidence in that. In addition to, there's a high level of professionalism in our healthcare system.
Thank you. Go here.
For Pullman, I think we're lucky because of the classes, the seminars that Pullman Regional Hospital makes available to the community at no charge.
Thank you. Table 10.
Okay, so the consensus at this table was that we're not dead yet. I'm just the spokesperson. I didn't come up with these things. And interestingly enough, one of the negatives from the first question was not being able to choose your own provider, and one of the positives for question number 2 was being able to choose your own provider. So it's kind of a dual.
Thank you.
We've got a really interesting mix of folks at our table. We have providers, we have healthcare workers, and we also have patients, frequent flyers, we even call them now. And something that everybody also agreed on was that the amount that Pullman Regional Hospital and the providers around this area really care about their patients, and that's something that's a massive strength in this rural community.
Just piggybacking on what you said, our group was talking about, a lot of us work at the hospital, and we really appreciate that we are supported to do quality care first and given the freedom as practitioners to decide what that looks like. We are also invited to notice trends in our work productivity and take personal responsibility in impacting the success of our organization, which again we appreciate. And we also, some of us are pediatric therapists, and we appreciate that Medicaid is something that we are allowed to, we serve Medicaid patients, quite a few actually.
Great, thank you. In the back.
Our table talked about the fact that emergency care is very accessible in our area.
So the word that this table really kind of latched onto is nimble. that because the hospital is pretty small and has that ability to be pretty nimble and react and not have a lot of hierarchy and a large healthcare system, that we feel like we can do things that are right for the patient at the time and try things a little bit differently. Also, because we are small, our customer service is pretty incredible. And in the emergency department, you really don't have to wait that long. It's unusual to wait. And again, our attention to staffing ratios so that people feel like they have the time to take care of you and not have to worry about being understaffed.
Thank you. Anything else? Any final comments? Table 9. Oh, we'll go over here first and then table 9.
So I'm relatively new to Pullman, and my table here had just really amazing things to say about the local healthcare system, despite all of the difficulties from question 1. Just couldn't stop saying wonderful things about Pullman Regional Hospital and the quality of the providers here, the quality of the administration, and a feeling that from the top down, they're really driving quality in their staffing as well. They also talked a lot about scientific innovation and the availability of specialty care and the highest quality care in every way, and just a general drive at PRH for improvement and for quality in care.
Great, thank you very much. Table 9.
Table 9 will stand up for the positives. We had a lot of good things to say because we very much appreciate our healthcare community here in Pullman. For some procedures, our table observed door to door. Leave your office, have the procedure back to your office 30 minutes or less. With the patient portal, you can have the results of your tests delivered in less than 2 hours, and that the ReadyCare system provides excellent and responsive care with or without an appointment.
Great, thank you. Any final comments for question number 2? You have a fabulous community here. I'm up in Spokane, but as the Novia Foundation, we serve 20 counties, 10 in eastern Washington and 10 in North Idaho. And so we have the opportunity to work with our partners throughout the region. And I'll tell you, you have a great team here in the Pullman area. It's just been an honor to work with Scott and Becky and Ruben and to get to know all of you as we've become more engaged in your community. You have a fabulous group of people here. And then the last question, which is what we're really here for today, isn't it? And that's talking about what do we want the future of healthcare to look like for us? If we could wave our magic wand, what would it look like? What does that next year of excellence look like to you? Who would like to start on this one?
So that we could have everyone feeling secure, good communication, wellness is available for everyone, access is available for all, and the thought of maybe shifting the resources from the last 6 months of life to prevention so that we can really have a good, solid healthcare system.
Thank you. In the back.
Our table talked about the need for integrated care and better improved communication between providers. That the healthcare system be not so financially based and more preventative and wellness focused.
Yeah, thank you.
Thank you.
I'd like to speak to that too. I think that we should have more preventative wellness or concentrate more on that. Maybe for people that choose a more holistic approach to have more of that available, things like acupuncture and chiropractor and just more natural type measures. I know insurance is starting to cover some of that more, but some of us are being left kind of wondering how to proceed with things. It would be good to have some of those alternative therapies part of the real mainstream also.
Great, thank you. Who else? Okay.
Just another comment from our table about communication and just having that be seamless and the opportunity to stay well and be well. And then sometimes it feels like the deductible dictates when we get care, and it would be nice to be able to get care any time of the year, not just all at the beginning of the first 3 months so that you can pay your deductible and hope that the rest is covered. It's like a game.
I've played that game before. I understand it. Who else?
A rate
Over
of
here.
0 for hospital-acquired infections.
Say that again.
A rate of 0 for hospital-acquired infections.
Great, thank you. Up here at table 2.
That what care you got is based on where you are in your life cycle. So it doesn't really matter that I have OB care at this point in my life. So it's a matter of how can we kind of have that fit where we all are in our lives.
So to add a new one, because we talked about a lot of these that have already been mentioned, but the idea of integrating mental health into primary care and not feel like it's a separate thing and have that be part of the primary care visit and less stigma around that in the healthcare system.
I can say this, so I'm going to, but I would encourage all of you to be active in the legislative session that's coming up this year, as there is a big push for increased mental health funding, and I would agree with you completely. The mental health issue, I think the state legislatures finally realized that it will be the next McCleary. So I believe that we do have an opportunity this next legislative session. So, next, anyone else? Anyone want to comment on the experience that you had today when you walked in with the coordinated care?
It had a very personal feel to it. I thought it was really nice. Of course, we're in a nice surrounding, but that's something else I think is lacking, and a lot of it's time issue. But for the doctor to really, or the healthcare practitioner to really hear what the patient's saying, because things get misinterpreted, and I just thought that that might help with that situation.
Thank you. Over here.
The thing that I really liked that you guys included was the adult care as well as child care. That actually happened to my mother this summer, where she wasn't sure my dad would be okay and she needed to stop and get care. So I think that's really important to take into consideration as well.
Thank you.
I've just noticed when new ideas come about that are going to work, they just seem obvious. And when I went through this, it just, the overwhelming feeling is of why isn't this being done now? It's just so obvious. So that's how I have to say.
And who else? You can borrow my microphone if you'd like. I'm close. You just have to come get it.
Something that I really liked was that you get your labs done, you get your x-rays done, the doctor sees them that day, and you hear from the doctor that day about it. You're not waiting for a call, wondering if they forgot about it. Also, the child care is huge. As a mom of 2 young boys, I mean, it's hard enough to get to the doctor and schedule around nap times, but to have someone watch them so you're not juggling them. I know that's not everyone's situation, but for young moms and dads out there, it's huge, so.
Thank you. I'm going to add that from the rural perspective and all the rural communities that we serve, being able to do that one-stop care and having all of the appointments on the same day really helps with the accessibility piece, especially for those who are homebound or who are challenged with transportation to come in to receive their medical care. So that one-stop coordinated care would cut down on transportation issues that arise. Who else? What else? It doesn't have to be related to today, but any other final comments around what you want to see in your ideal healthcare system? Up here at table 2.
I think the adult care and child care that was very impressive. I would like to suggest to expand the concept to the staff members who might have the sick child, so then they can come and take care of the patients too.
And as we're bringing a mic up to this table, I'm going to throw out there my last question for you that I want you to be thinking about is, what did you want to share with us that didn't fit in these 3 questions as we think about where we're going with this next generation of excellence? So be thinking about that as we go to this table back here and then up here. I'll start in the back, sorry, and then up here.
Well, one of the things that goes right along with your your next question is the overall aspect of paying for health care and how people end up in this country going bankrupt because they do not have insurance that covers all of their care or enough of their care. And so it perfectly fits with, I think, part 2 of your question, that we need to figure that out in our country. And I know this town is trying to do as the best job they can to do that.
Thank you.
I just want to make sure and put on the record something that was discussed at our table, and that is owning your own health data. A lot of the repetition of filling out forms and a lot of the things that were in the video that we laughed at are real. And so there's 2 things. One, having it in a repository somewhere where you could access it. You don't have to keep redoing your history and maybe lying about it the second time. And also also owning your own healthcare data.
Thank you. Final comments on question number 3. Any final comments that as you think about what you want to see? Yes.
Yeah. Seeing all this makes me realize that the future of healthcare is not going to be driven by some massive health system in a big metropolitan area. It's going to be driven by a critical access hospital that's willing to say yes and try these things. And without 100 people telling them no, they can't, but they have the opportunity to do stuff like this and try this quickly without the overhead of a major system in the way. So these are the kinds of ideas that are discussed at these big events for huge hospitals, but they never move anywhere. Where here, there's an opportunity to actually make progress. So I want to see where that goes.
And I love that you said that, because Scott's going to share with you later how you can all be involved in making this happen.
I had a question about reasons people end up going to Spokane, Lewiston, and what could we start providing, I don't know, like some kinds of cancer care and so forth that we don't have available that maybe we could provide so people wouldn't have to go out of town to get those services?
Thank you. All right, and then going to my final question that I threw out there. Oh, go ahead.
Table 9 again.
Table 9, go for it.
So the integrated electronic medical records, and we experienced that in our entry into the event tonight, but real-time updating and sharing of medical records between providers, huge. Quick story, our son broke his wrist his sophomore year of college just before he went to study abroad in South America. And he saw Dr. Tingstad, who, it was a very tiny bone, casted his wrist, and then a couple months later, it doesn't seem to be healing properly, and the surgeon in Chile recommends surgery. And he's not coming home for 4 months. So I called Dr. Tingstad, and he said, you know, we have this system where we can upload x-rays, and I can review his x-rays, and I will advise you. But medical care in South America is actually very good. I spent time there, he tells me on the phone. And so we did all that, he reviewed it, and he said, there's a hand specialist, Paul Horn in Spokane. I think it can wait until your son returns in December, and I would refer him to Dr. Horn. All because sharing of medical records. My story.
Thank you very much. So that final question that I threw out there is, what didn't we ask you that would have prompted, or what comment did you want to say that you didn't get to say because it didn't fit into one of these three questions as we think about that next generation of healthcare? This is your opportunity, it's one of those wild card questions that no facilitator should ever throw out there. But I am giving you the opportunity on an open mic to say what you wanted to say that you didn't have a chance to say. This is it. Because my time's running down to like the last minute. I think I'm actually over by 1 minute.
I would just like to say that for our table, we felt that we have fixable problems. And we're blessed to live in an environment that there are solutions to problems. Now, it takes prioritizing, and we understand that that's a challenge. But really, the problems we have are fixable. It's just a matter of how we prioritize which ones we're going to fix and how we approach that. But these are fixable problems. And so that mindset has to happen first, that these are fixable, not insurmountable, but fixable problems. And then moving forward, okay, what do we fix first? And I think that's the challenge and the fun part. How do we get to fix these problems?
And I think that is actually the perfect comment to end on for me to be able to turn it over to Scott, because he's going to come up and share with you do you have one more? I'm sorry. We're going to get one more comment in there. I apologize. I didn't see you.
Okay, this doesn't wrap anything up. It adds a different dimension.
That's
but
okay.
I would be most remiss if I didn't add adult day health programs to the continuum of care.
Thank you. Thank you very much. And if there are things that you did not say tonight out loud that you want to make sure we capture, can you please make sure that you pass in those notes to us, hand them to Becky or Ruben, one of us, so that we can make sure we can pull that information together and compile it. I appreciate all of you taking the time to share out with us as we learn about what you want to see about your future system. And with that, I'm going to turn it over to Scott, and he's going to come up and share with you the history of where we've been, where I guess I'm not turning it over. I didn't read the program correctly. But Scott will be coming up to share with you, I believe, about the history of where we have been and where we are going, and how you all can play a role in creating your future healthcare. Thank you very much.
Thank you, Shelley. You did a great job. We appreciate it. So, actually, I'm going to introduce Scott Adams. I want to talk just a second, though, about innovation. Of course, as you might guess, we've been thinking about it somewhat lately, and I was thinking about what is the most innovation? What does it look like? Is innovation continuous new experiences? And I thought, in my personal life, what's the most exposure that I've had to continuous new experiences? And it's when I was lost in the woods. Every time I went around a turn, every time I went around a tree, brand new experience. I said, that's probably innovation is something more than just new experiences. Innovation seems to be something along the line of including making it better. And tonight we're talking about making healthcare better. It involves facilitating an environment where you've got this less fear of new experiences, but it's not just about new experiences. It's not about being the most unique. It's nurturing an intersection of diversity. And that includes a diversity of people, ideas, beliefs, knowledge, and creating an environment where those things can intersect and help to make it better. And it also involves strategic planning and rolling up your sleeves and doing some of the work. Scott Adams is an innovator. Most of the time when you introduce somebody, you talk about what they've done, but I think probably most of the people in the room, you know about some of the things that Scott's done. I want to tell you a little bit about what he is. He cares about those of us working in healthcare. He cares about the patients. He cares about the community. In fact, he loves us. He's bright. He dreams, and he thinks big. There's a Pentecostal minister and rapper called Reverend Run. He says that dreams are made 2 sizes too big so you can grow into them. Now, Scott's one of those guys who's growing into those big dreams. He's humble. He's respectful. He's respectable. He's trustworthy. And he's innovative. Scott's going to share with us how an innovative idea can make things better and usher in a new era of excellence in healthcare.
Well, this has been a wonderful night, and I told a few folks as we were gathering before dinner that this was a grand experiment. This is the only time we've ever had a format like this for this summit. And I just want to give another acknowledgement to Becky. She did great work on this, and it was an idea that we kind of came up with a few months ago, and she pulled it all together. So please join me in thanking Becky for that. There's a couple other acknowledgments I want to offer. As you participated in the introductory experiences with the orthopedic scenario and the wellness scenario, there were this gaggle of volunteers that had been working along with Becky for several months. If they could please all stand up, just so you could acknowledge them for their efforts and preparation and in At some level in the early stages, they kind of struggled with getting their arms around this idea of trying to create something that doesn't exist. We'd bring up a thought and they'd say, well, we don't do it that way. And we said, no, we're talking about what if we did it that way. And once they caught that notion, it took off from there, and it's been really exciting to see. And thanks to all of you for being a part of our conversation tonight. I also want to make special acknowledgement of some detailed touches that usually escape my attention, but did not those who were doing the planning. You'll notice all of the background lights here match the color scheme of the programs. And thank you to Chris at Neil's Flowers and Mitch and Mary Jo. The flowers also match the color scheme. So pretty nice attention to detail. Last year when we held this, and it's great to see the Casbar family here with us again. They've been with us several times at our Innovation Summit. And they shared some of the work they're doing. And as we concluded last year, we had several copies of a book called What Do You Do with an Idea? And I want to take my remarks from that context as we finish up tonight and hopefully leave you with something that instills excitement and enthusiasm, but some work to do. So one day we had an idea. And we thought about this idea, and generally that idea was, how can we create a healthcare organization that really makes a difference in people's lives? And so in 1993, we began that process, and we gathered a lot of people. We didn't have a session like this, but over the course of several months, we got input from over 300 people. These were volunteers and community members and staff and physicians about what would that organization look like? What would be the things that are important the values that we espouse? What would the vision for what we would hope to create be? And how would we describe the purpose of that organization that's going to make a difference in people's lives? And from that was born the values and the vision and the mission of Pullman Regional Hospital, which remains the same today. We deliberately intended it to be something that would sustain us for a long period of time, because we knew our idea would probably take a while before we'd start to see it show signs of reality. And so we did that. And we've been working at that idea for a while. Once we did that, we started thinking, what are other people going to think? What if they don't like our idea? What if they think it's silly? What if they think it's crazy? So we thought, well, let's maybe offer some other thoughts that might be a little more concrete to think about. And so we began to describe how this new idea might function in our community. And we described this sense of community access and support of the university, and how physicians and other providers of healthcare services could be gathered in a single location, and that we could begin to create and realize this medical campus concept as a part of this integrated delivery of healthcare service that was an early part of this idea that we had. And as we began to talk about that, we said, we like that idea. It kind of feels magical. It makes us want to see it become reality. And we felt better, we felt happier when we talked about it, and kind of dreamed a little bit of what if, what about that day when we see this become a reality? So much so that in 1998, we expanded on that concept and that initial idea, and we said, we see that this single location where the majority of individuals and agencies and providers would be located could aggregate and provide great opportunities for cost sharing and patient convenience and integration of care, that we would assure a healthy healthcare system for our community. And in the face of change and uncertainty that is a constant in healthcare in our country, we'd have this united community asset that would be able to make a difference in people's lives, and it would help us start to fulfill the purpose of, at the time, Pullman Memorial Hospital. And so we began to share that, and we passed that along to the Board of Commissioners at the time as a part of a recommendation that we move forward with trying to make this idea reality. But as we thought about it, we said, do we have the courage? Should we take a step? Should we actually reach out to see if it's possible to make this idea start to be a reality for our community? And so finally we did. We mustered the courage. And in 1999, the community was asked to help us start the ball rolling with making this a reality for our community, with a proposal for funding to build a new hospital, to create the Pullman Care Community, to make it something that could then begin to build on as we went forward. It failed by 27 votes. And we said, we're almost there. So in the next election cycle in 2000, we asked again. And it wasn't as successful that time. And so we were a little bit adrift. We weren't sure what to do. So we took some time and we rethought. We explored other ideas. We said, maybe this isn't the right idea. Maybe what we're trying to do isn't what we should be pursuing. And we considered alternatives. Finally, in 2001, in November of 2001, the community saw the value, supported our efforts, and the bond was passed that led to the building of Pullman Regional Hospital, which opened in December of 2004. And with that, there was a new star added to this light for the future, this light of excellence. And the current era of excellence was ushered in with the establishment of Pullman Regional Hospital. We designed it to house state-of-the-art technology. We looked at patient convenience. We used leading design concepts to help make sure that the flow of care was responsive to the needs of patients as well as coordinated the work of providers in the hospital. We paid attention to how can we expand as opportunities and needs for better serving our community arise. We wanted to make the hospital a place where the community in general would feel that they could come. It's a gathering place. And ultimately, it was a place where the community saw it as a source of inspiration, a source of solace, and a source of healing in their lives. And so we've continued on that journey, and it's been exciting, and the community's responded, and the support we feel every day is so impressive and inspiring for us that it spurred us on to see and identify new ways to serve and to develop services. And finally, several years later, we began to realize that our idea was changing. It was starting to take on a new form, and it had additional parts to it, new things we hadn't considered previously. And it's almost like it started to have a life of its own. And we felt this idea starting to grow and expand. And in 2012, our bigger idea became there can be a new model of care that in addition to the acute care we do and the medical services we provide, we can look at how do we help the population be healthier? How can we change the way health care is delivered and organized so that we can pay attention to improving individual health and helping people better manage their illnesses and their health care in a timely way? How can we still pay attention to facilities and technology to make sure that we're bringing the most up-to-date aspects of medical care to our community? How can we make a difference in the cost of care? How can we create an experience where each person who has a relationship with Pullman Regional Hospital feels that it has a positive impact in their life? That's not just patients, that's physicians, visitors, volunteers, staff. How can we create that in the way that we continue to grow in our ability to serve our community? And so we did that. And as we talked about that, and as we realized the new opportunities that could come from that, and as we shared those thoughts and ideas, our idea began to grow, and it began to expand. And now it's reached this level that now in 2018, we talk about the next era of excellence. We talk about one-stop care. We talk about an integrated and coordinated experience for patients and providers that is the thread of connectivity is a personal electronic health record and facilities that can bring and house all those activities and services in a single location. And so what does the next era of excellence mean? How do we get there? What would it consist of? I want to share with you at least our early thoughts in an overview fashion of how we see this moving forward and drawing in the information that you shared tonight. Coordinated care or one-stop care has at its core a hospital and patient integrated electronic information system, so that some of what we saw in that parody in the video and some of what was described tonight can be eliminated, that we don't have repetition of information, that we don't have gaps in care, that we don't have lost information or information that's siloed in some other provider's office and we can't get access to. Physicians are on one campus along with other providers, and there's an opportunity to coordinate that visit just like you saw here tonight, so that when those patients come, it's a single experience and they accomplish multiple things in one time. And that care is coordinated, and the information that's shared is uploaded and available in a timely fashion in real time. It allows us the opportunity to create a suite of services for certain types of care, so that you know that when you're coming for your diabetic care or you have a chronic illness with asthma or COPD, that there's a set of services that are probably going to be a fairly common activity that you will do, and you know that you will receive those each time you visit. That also provides us the opportunity in a more coordinated way to change the way people experience the financial part of it. And why couldn't we have one price for a suite of services? And of course, care coordinators will be at the core of that. Somebody asked this evening as we were visiting beforehand, what's the type of training that those people are going to have? Well, we're learning about that, and we've been experimenting with it for several years now. I think what we've learned is that people who have backgrounds in training in social work bring a wealth of information and capability to the understanding of a breadth of services that are important for a coordinated experience. So social work may be the starting place, and then adding to that in how we organize those activities. And so to make it possible, we need 4 things. As we're looking at the next era of excellence, we need 4 things. We need this integrated electronic personal health record. We need additional space to aggregate on the Pullman care community the services that can make that one-stop care possible. We have to continue to pay attention to medical technology, as it is at the forefront of meeting the needs for providing up-to-date medical care. And in the course of 15 years, where we provide services and some of the growth we've experienced, we need to expand and remodel some of the space of the current hospital. When we think of that new space, it's 45,000 square feet on 3 floors. It's the colored part you see here in these diagrams. It's attached directly to the hospital. It would house physician offices and other things that make this care coordination and one-stop care possible. The white shaded areas are the existing hospital building, and then the other parts that would be added are the community health pavilion that we refer to as part of the next era of excellence. When we get inside that building, we see the combination of services. The first floor might be the health and wellness floor, where you see adult day health there to provide that aspect of care that allows a spouse or a child taking care of an elderly parent to receive their own medical care, knowing that their loved one is going to be cared for in an effective, expert way. Medical fitness, where you have services of nutritional counseling, demonstration kitchens, cardiopulmonary rehab, health coaching, services such as for Parkinson's disease and certain types of therapies and other chronic illnesses, a drop-off daycare. We'd expand our simulation training for healthcare professionals to bring real-time opportunities to upgrade skills and stay current in areas of medicine. We'd hopefully see space for our Center for Learning and Innovation, expand our capacity to do telemedicine, not only bringing specialty care in, but being able to reach out to more remote areas of Pullman and Whitman County to provide care, thus also addressing some of the transportation challenges people have. And then additional room for education and training. On the second floor, maybe this is where we see the women's portion of the Center for Women's and Children's Health, and you have a women's care coordinator. You have physician offices such as the obstetricians and Pullman Family Medicine. Maybe this is where the physician residency, where we could do training of future physicians here in Pullman, would be located. Other services such as ultrasound, mammography, acupuncture, massage services, genetic counseling, all these things have a role in how an integrated, coordinated experience of care can be developed. And finally, when we look at the third floor, maybe that's the location where we have children-centered care as part of the Center for Women's and Children's Health. The pediatricians are there, behavioral health services are there, lactation counseling, feeding teams, speech therapy, pediatric gym, pediatric therapy services. All of these things become a part of, and they're all ideas. None of this has been decided. That's because we're having this conversation with our community to provide that input and get prioritize, as Dr. Tingstad said, what are the right things to have in this new space to best meet the needs of our community. I know that some people are saying, who's going to pay for it? I think Shelley appropriately identified the opportunity that we have as a community to decide that. It's costly. The integrated personal electronic health record that is coordinated throughout the entire community is a $10 million expenditure to bring that all online and support it to where it's functional and works without difficulty. Creating space to create a one-stop care experience is a $20 million investment for our community. Paying attention to our medical technology and assuring that it's up to date and we can respond to new technological advances over the next 5 years is a $5 million cost, as well as the remodel and upgrading of our hospital facility in the next 5 years is another $5 million cost. The math's not too difficult. That's a $40 million proposal for our community to talk about and to think about and to determine if that's going to best meet our needs for how healthcare can be made a meaningful experience in our lives and something that does away with the current frustrations and creates something that sees us a new opportunity, new possibilities for our own health and for our community. So We have a plan for how we can fund that, but that's where the partnership comes with our community. The hospital will be able to do some of the funding, but not all of it. We're preparing a report for the Board of Commissioners that will be presented to them in November, where we will propose that a tax levy be presented to the community to support a significant amount of this cost to move to the next era of excellence. We're also working with our foundation to develop a fundraising plan to help add to that component of funding to help bring us to that $40 million that we need to accomplish the next era of excellence. So you'll be hearing more about this. You'll have opportunity for additional questions. You'll be invited to share thoughts and ideas over the next several months as we move down this path along the recommendations that we'll share with the Board of Commissioners. So there you have the next era of excellence and a brief history of what brought us to where we are today. And so I started with, what do you do with an idea? And what you do with an idea is you change the world. So my invitation to each of us tonight is join with us. Help us change the world of healthcare in Pullman through the next era of excellence. Thank you, and have a good evening.